The last time I spoke to you was around 3 to 4 months ago. The world today, compared to 3 to 4 months ago, how do you see it? Do you believe we are in a better place than we were, considering that COVID-19 hasn't gone away, deaths are closing in on the million mark? Why don't you start, Dr. Van Kerkhove, with that? Are we in a better place?
Well, thanks for having us on the show, and it's good to see you again. Indeed, we're coming up to a very sobering and tragic milestone of almost 1 million deaths due to COVID-19. The world, it's very difficult to say exactly where every place in the world is because we're dealing with different intensities of transmission with this pandemic. On the one hand, countries are much better placed to deal with this virus. We know so much more about this virus than we did 3, 4, 5 months ago. We know what works in terms of breaking chains of transmission, in terms of controlling this virus. We know what works in terms of saving lives. And so there are a number of things that are in place right now where we have earlier case detection, earlier admission into hospital for clinical care for those that need it most, earlier access to oxygen and ventilatory support, dexamethasone for people who have severe and critical disease, and all of that is saving lives. And so we're in a much better position than we were a few months ago, but it's still quite precarious. And we are worried about some increasing trends in a number of countries across the world, not just increasing case numbers, but increasing hospitalizations and increasing numbers of admission to ICU.